Let's start. For those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients or their relatives who have kidney disease or are at risk of kidney disease to be better informed so they can take better decisions regarding their care together with their own doctors or with me if they choose me, so they can minimize their complications and they can minimize their worries. That's very important. Okay, so let's start with today's topic, that is hemodialysis permissive of traveling? The simple answer is yes. People on hemodialysis need or can travel overseas because of pleasure, business, or an emergency, or simply just for a wedding or anything like that. If you are a hemodialysis patient and want or need to travel, first of all, you need to assess the COVID-19 situation worldwide, in particular in the country you are and in the country you want to travel to, because the COVID-19 is still spreading in many countries, and second, phases cannot be excluded in others. So to assess the risk you could be exposing yourself to, and also to assess if there is any traveling restrictions imposed in the country you're traveling to, including the requirement for quarantine. That can vary a lot. So your dialysis center or your health authorities can advise you more about it. And also do contact beforehand the dialysis center you are trying to go to, at the country you're going to go. As mentioned, in general, yes, you can travel while undergoing hemodialysis, but your traveling plans and itineraries might need to be modified, but not necessarily avoided. Some patients believe actually that they cannot travel, or because they see that the hassles for traveling will be unsurmountable, they just avoid traveling. You can do it. Indeed, it's not going to be like if you were not having dialysis, or it's not going to be as simple when you are at home, but you still can do it, undergo your dialysis, and enjoy whatever you're doing in the foreign country. In fact, many centers overseas offer the so-called holiday dialysis, and in Singapore, many centers also offer that. As I'm a specialist private doctor, I have helped foreign patients on that, obviously before the COVID-19 times, for those foreign persons that were traveling to Singapore for leisure or business, trying to make their process and as stress-free as possible, obviously from the point of medical doctor nor or as a travel agent, yeah? In addition, it is important to check what are the requirements of the other country or the other dialysis center for them to be able to dialyze you in their facilities. For example, if they require you to have blood tests results for your hepatitis B or C status or your HIV status, obviously a dialysis prescription, what you normally are subjected to, etc. So do double check with them. Every country and every center has their own requirements, so avoid disappointments, and worse, avoid remaining in limbo, arriving to a foreign country and then finding that your dialysis center cannot dialyze you because they do not accept certain patients, let's say having hepatitis B, and you unfortunately have hepatitis B, and then you suddenly need your dialysis and you don't know where to go. So that will be not an ideal situation. And some patients, what they do, they simply skip the dialysis when it is very dangerous, or they need to book themselves in a hospital and through emergency services, which is going to be a lot of time consuming and expensive as well. Make you waste a lot of time and mood finding a new center as well. When with proper planning, this could have been avoided because you have better things to do when you're overseas as well. So it is not just drop by and get your dialysis done, as many people might think. A very important advice is to look for a trustable center. That's the first. And second, an affordable dialysis center. There are many published lists of international centers on the web. And ask whether your dialysis coordinator, your nurses, or your doctor can help you with the preparation, selection of a center, and the planning. They might not help you with selecting a dialysis center overseas because they might not know, but at least they can help you with the planning and getting all the documentation and requirements that the other dialysis center needs ready, including helping you, getting all important documents, as I mentioned, like could be a letter written by your own doctor regarding your medical condition, your current health status, list of medications, the hemodialysis prescription, obviously, any dialysis charts, so that the other dialysis centers more or less know how you normally behave during the dialysis, latest laboratory tests, including the viral test I already mentioned, and occasionally other investigations like could be important, like an echocardiogram, because you might have a heart condition, and some centers, especially if they don't know you, they might be a little bit worried about accepting you without knowing how is the status of your heart. So do check with them all the requirements before going to that dialysis center, and also check the requirements in the welcoming country, the administrative requirements for beyond immigration, but also they might have other health requirements as well. Also remember that on and off hemodialysis therapies performed in a foreign country can be much more expensive than in your country. However, one of the main concerns of patients and care providers is getting the chance or the risk of an infection, a viral infection like hepatitis B, HIV, hepatitis C. Forget at the moment from COVID-19, but getting all those blood-borne infections. True, that can happen. Nothing is ever risk-free, but it is just matter of finding a reputable center which you can put your trust on, feeling comfortable and safe, especially for common travelers. Some patients who travel a lot find rarely a problem. So, but just do your homework about that. Before concluding, I want to give you a couple of more pieces of advice, because many patients, when traveling, put themselves into a holiday mode and mood and start eating more food and drinking more fluids than their usual, as they try to enjoy their holiday. Obviously, if you're on holiday or else, you definitely need to enjoy it. However, going into some excesses can make you run into problems like high potassium or fluid overload. And some patients have required emergency dialysis overseas or needing to come back because of that, cutting their stay short and also putting their life at risk. So try your best to enjoy your holiday and local delicacies with moderation, and understanding that there is still a disease that you need to take care of, and your health is primordial. Other patients also stretch their luck when traveling overseas. They just simply, to avoid going to dialysis center or avoid paying, they just want to skip a dialysis session or even more, or arrange a lesser number of dialysis sessions overseas instead of 3 times a week, 2 times a week, or even sometimes once a week. I have seen patients that have missed dialysis for 1 week just because they went traveling. Indeed, it is more expensive, and I feel for you guys, and it can be more troublesome and more time consuming than licensing overseas. As I mentioned, many patients do it. Many of them get lucky and no major thing happens, but many run into complications, need an emergency admission and putting their life in danger. And worse, spoiling their holiday or their visit in the other country. So please, please, please do not do that. Aim to follow your normal prescription as best as possible. Extra cost and hassles will incur, but it is part of traveling. It's part of the responsibilities and commitments when you have when traveling. If you travel, you don't expect that things are going to be cheaper than in your country. So it is the same. So just put yourself in total holiday mood. You might need to pay a little bit more money, but not spend health, because your health is the most important. So please, no shortcuts on your health and your well-being, because those extra bucks, can come back to you later. Or if you have a complication, that sometimes cannot be repaired. In Francisco Clinic Medical Center, we advise our patients and their relatives on traveling preparations, knowing how important traveling is for someone's lifestyle. So if you need your help, please contact us. Dr. Francisco wishing you the best possible health. Take care. Bye-bye.